Right. I don't know if that lighting is better. Hey, you guys. A lot has been a lot has been going on, but um, this is not really a study with me. I'm just doing some homework for OB. And hey, girl, this is my first time doing live, so obviously I just came from drinking a little bit. But yeah, I'm about to just do this OB assignment. So pretty much, thank you. But pretty much, with this OB assignment, we have not got a lecture yet. Sorry if y'all can hear my daughter in the background. She playing with my mom. But we haven't got the lecture yet, but it's actually assist delivery and cesarean birth. And it's 4 pages long. And that's why I came back. We had an online assignment to do for chapter 10 recently, but obviously that ain't got nothing to do with this assignment for chapter 11. I thought we were supposed to get the lecture first, then do it, but no. But this is also a quick live update of what's been going on because I'm not about to sit here and let y'all watch me do this boring assignment for OB. I think OB is really boring. I don't really care for it all like that. I like the OB outpatient clinic that we recently had done because that OB doctor, she was strict on like being on time for her class, but overall, like, I mean, for her appointment, but overall, like, the experience, her MA was nice, her student nurse practitioner was nice, and she was actually a midwife, and she was pretty cool. Like, I enjoyed myself, and I even had like a cool patient. The only issue that was wrong with her was that she was close in pregnancy. They usually want you to wait like 2 years after having another baby. No, that's not the right hat, but that's fine too. I left my hat so she could put it on her head big enough. Yeah. So, but she was having her baby like a whole year later or something like that. But yeah, that's pretty much it. It was cool though. But anyway, I just want to give you guys an update. So, my grades so far in second semester, before I tell you how real it is, I have all A's, and that also includes like with we have 3 clinical sites to go to, but I only been to 2. I start my 3rd clinical site after our spring break, so it's like literally 3 weeks after, not even 2 weeks after. What is that on your neck, Denver? Vicks, okay, go. Shut my door. I'm doing something. That smells good though. I need some. You okay? Say stupid door. um, kind of, sort of. I have all A's and 1B. And of course, that B is in freaking med surg. And like I told y'all, the lowest we can get in every class and overall is 84%. And at 84%, I'm at, okay, this what happened. 2 weeks ago, I was on top of the world with, med surg. We had to cardiovascular 1 because we had cardiovascular in 3 parts. Yeah. Yes, don't complain. I wish we had shit. Can we get 75? 84 is, and that's overall. Like, you can have all A's, and if you have like an 82 in one class, you cannot graduate. Like, they kicking you out. Well, they not gonna kick you out, but they gonna tell you come back next year. And yes, you might not have to take the other classes. You just have to take that one class. But yeah, it's crazy. Like, you have to have an 84% average in every single class you take. So that's really like a headache. A headache. But like I can say, like, first semester you get 7 classes. Like, I was granted 4 because 3 of them classes I didn't have to take. But I still sat through some of them. But these like 3 classes we take. Wait, med surg farm. We take med surg farm and med surg farm and OB. I'm sorry. And then they do like dosage calculations, but she don't she does not teach you that. You supposed to know that from first semester. Denver, I'm doing something. Go with grandma. Thank you. Love you. Yeah, she don't teach you nothing with math. If you don't know it, you don't know it. But I got 100%, a solid 100% in that. So, and it's only like, when we take the quiz, it's only like 5 points. But I think the next couple tests, they're supposed to be 10 points. But farm can vary from as low as 30 to, I could probably say as low as 25 to 50. I know the next farm test in neuro is 50. And that's like probably going to go over everything as far as respiratory, cardiac, and neuro. And with the neuro, we only learning the epilepsy medication. So I'm really good with that because I want an epilepsy floor. The back of my shirt talk about it, but this is a Cleveland Plumbing shirt. I don't know if it's inside out, but I got saggy boobs right now. Let me see something. Hold on. Actually, you know what's crazy? When it comes to farm, I don't really study for it. And I don't know, like, the math just come easy. I think, okay, my binder downstairs. I promise the next live I do, I will show you how my binder is. But as far as like, because I'm going to do my med surg studying, because I actually take a test for neuro on Tuesday. Hopefully she don't cancel. I know she canceled for the other class today. Her friend had a baby. She got to watch over her friend, other kids or something like that. So yeah. Hey Simone. Hi girl. Simone goes to my school, but she's in first semester. But congratulate her because she got student of the month. I hope they never vote me because I don't want to be that. I'll pass. I just want to graduate. But since Simone, since you on here, I'm gonna give you a heads up about second semester. Ask this question. I'm gonna ask you this question. Just answer it for me. So, did they give you this book in first semester, Simone? Oh, congrats! December was just here. Congratulations. I hope she's seen that because if she did, something like it. Okay. So this will happen. Angel is going to be your instructor for next semester. Angel actually had this book for second semester, but then first semester took over it. But this book and, I think my other NCLEX, you're going to get 2 NCLEX books. You're going to get one for first semester, you're going to get one for second semester. When it comes to studying for like med surg, use it. Because she basically take questions out of this. She take questions out of this. She take questions out of Prep U. And some questions she make up on her own. But everything she teach you in the lecture, just study. You know, sometimes you probably need to read the whole little outline, but that's it. I'm going to let you know. But actually really use this book, whatever. And I actually like this book. I hope you got this one. Because the other one I like, but I can't stand that the answers is right next to the question. I can't stand that. I don't got time to be hiding it on paper. But if you got this one, if not, just hit me up. I'll bring it to you. I don't care after I'm done. Well, hold on. Let me pass NCLEX first. And then I give it to you. But, anyway. Anyway, so med surg, I'm at an 85.92. So technically, once you're at a 0.5, it rounds up. So basically, I'm at an 86%. And I'm going to just tell you how to B ranges. Since our level, whatever, our grade average should have to be at 84. 84 to 89.4 is a B. 89.5 to 100% is an A. But 83.4 to like 70 is a C. Lower than that is a D. Lower than that, like 60% is an F. So basically, like 2 weeks ago, I was on top of the world. We took cardiovascular 1. I had an 88% on that. And when I thought that test was so hard, I felt that it was so hard. Like, I was like, I'm walking out of there with a D. Like, and I was just so, like, I don't remember nothing, but I was surprised that I had an 88. And it was 50 questions, so obviously I got 44 questions right. So that was pretty good. Then we had that same day after we took that test, we had a lecture on shock. And then the next following day, we had a test on shock. I think shock was either, I think it was like 25 or 30 points. But anyway, I had got a 90 exactly on that. So I was happy. I was like, yeah, you know, you can't tell me nothing. I raised my 83 up to an 86, almost that basically 87 because it was like 86.7. So it was like 87%. Then we took cardiovascular too. I had got a 72 on that. Cause that now I thought the first one was hard. The second one was hard because it talks so much about something that she mentioned in the first lecture of cardiac that I didn't think it was gonna be on that test. I thought it would have been on the first one, but it was on the second one. So I was like, ah, I need to pay attention. So small. Everything she talked about in cardiac, even if it was from like the first two couple chapters, just go back when you prepare yourself for next semester. I really want you to pass. I really want you to graduate. It's not bad, but it's just too much. Yes, they all. Yes, they always yes. And the crazy thing is like she actually, I guess the other, cause you know how they break up our class. I'm a part of XYZ. XYZ go to class Monday and Tuesday, and then they have clinicals Wednesdays and Thursday. Good night. So, Monday and Tuesday, what can I say? What I was about to say? Oh, yeah. So, Monday and Tuesday with us, it was like we do the lecture or whatever. And, what was I about to say? I hate that I got short-term memory. I swear after I had my daughter, I cannot remember nothing. What was I about to say? Oh my God. Oh, okay. So I guess the other class that's in the ABC go Monday and Tuesday to Thursday. And when they do Wednesday, Thursday, we do Monday, Tuesday, do Wednesday, Thursday. So with the other class, I guess they didn't do good on cardiac. So she made everybody do cardiac. It was the cardiac 2 test. I think people did good on the first one and the third one, but the second one, everybody had like a bad grade. Like I had an 80 on the third one, but that was still considered a C. But it didn't knock me down. I went down 3% because mostly that's 72% I got. But when I recently just took the test over, I got an 84. So thank God. Whoop whoop. I needed that. But that's pretty much it. Like I said, I have all A's and a B, and that B is med surg. And what I could tell you about med surg, you guys, you have to really like study. You really have to like learn this information. Don't study just to take a test. Like study because at the end of the day, someone's life will be in your hands. And you really have to study like that. You have to study as if this was your mom calling you saying, I'm having chest pain, difficulty breathing, my back hurt, my everything is hurting on me. What should I do? Like, you have to treat it as if this is someone special to you that love you. Your child come in with crackles. Like, you hear crackles in her lungs or his lungs. And you're like, okay, it's a possible chance you could have fluid in your lungs. You could have this. You could have that. You know, is it right heart? You know, is it left heart side? Well, left side heart failure because crackles come on that. Like, it's just you have to hurry up and think. Like, if this was my loved one, if this was someone I'm really concerned about, what would I do? And that's just basically it. I rumble off enough, I guess. But if you have any questions right now, you can ask me. Med surg is going to be everybody's struggle. No matter if you're in LPN school or in school, like, that is a struggle. Because it's like you need to know the basics. You need to know the normal. You need to know what happens when it's broken, what they look like when there's, like, what's the symptoms when they're broken, and how can you fix it as a nurse. Because, you know, you have to do some type of interventions before your interventions are all out and you got to call the doctor. Because the first thing the doctor's going to say is, well, what did you do? You cannot say, oh, my patient's having difficulty breathing. They're going to be like, what did you do? And you like, oh, I just called you. No, you have to try to put 2 liters of oxygen on, sit them up, make sure they in their highest Fowler's position, which is 90 degrees. Sit them up, Put the post socks on. Even if you have to bring the whole Dynamet machine in, or the robo nurse that they call it, stick it on their finger and watch it for the next 10 minutes to see if their oxygen go up. You have to do interventions before you call the doctor. Before you call the resident, the nurse practitioner, anybody, the staff on call, they're going to ask you, what did you do first as a nurse before you called me? And then you just say, I freaked out. No, you don't say that. You say, I did everything I can do. I did this, I did it, and have it down to the T. Like, I wrote it out. I did this, I did that, I did that, I did this. And they're still not going up. They went from 89. They went from 88 to 89. And I did this. And I cough and deep breathe. I gave them a bronchodilator. I gave them two liters of oxygen. I gave them this. You know, it's crazy because I'm almost done and I really feel like, dang, I'm really about to be a nurse. Like, I'm not about to be an aide no more. And, you know, they really try to downgrade LPNs, but no. The education, the study is the first year of RN. No matter if it's a BSN program or an ADN program. At the end of the day, this is LPN year is the first year of RN school. That's why when you do LPN or RN bridge, you're basically graduating within a year to 18 months. But people be trying to play us, and everybody knows, I feel like boot camp, right? Yeah, like it is. It definitely is. And I just want people to realize, you know, like, I have a lot of nurses that I work with that be like, oh, you're going to make a great nurse. You want to do this. And then when I tell them, like, a lot of them was supportive of me going to LPN school. And it was like, it was not my choice. I was going to RN school or whatever. But, you know, I told my story before. I got pregnant, deal with a lot of drama. I cannot give myself 2 years during that time to commit to a school when I had so much going on. So much. But at the end of the day, like I tell people, it's not how you get it. It's not how long you got, like how long it took you, as long as you fought and did what you could do to get it. That's all that matters. And a lot of people don't realize that. Like, everybody has a story. I just seen a nurse in my clinical today, because it's a hospital in Lake County that still hire LPNs, and they do an RN to LPN like group. And the team is, it could be an RN, an LPN, and STNA. And they work together. And most of the time, the LPN might get the most patients between her and that RN, but they get the patients most likely that they're going to discharge. That's not really that critical. As far as, like, because as an LPN, we could start IVs, we could hang up antibiotics after the first RN. After the RN do the first initial bag. But as RN, they can do more. They can do medication straight through the IV. We can't do that, you know. So we get the patients that we probably just got to do normal saline, a bolus on, or a patient that's about to be discharged that day. But we still have like 6 patients out of the 10. And if we need help, we just ask the RN who got 4. And she just look over that person. But the hospital is actually a good hospital. I like the little teamwork. The first week, they was kind of rude. They didn't want to talk to nobody. But I understand. But other than that, it was pretty cool. I still like it. This is my last week coming up with them. Next week. I just finished my clinical rotation this week. But next week, I only go to that to that hospital on Thursday. Wednesday, I'm actually going to I don't know if it's like special needs, but it's like a special school for like kids or adults that's like mentally delayed. And I'm going to be there from 8 to 2. So I think I'm going to do a video that day. And I'm also going to do like I think I'm going to do a study with me over the weekend for the nervous system. And if anybody want to watch that, I will. I might do a live for real. So yeah. Do you want to work at a hospital? I done did both in my life, and obviously nursing homes pay LPNs more, which is true, but their workload is so heavy. So I think personally what I want to do, I think I'm going to try to work into, I would definitely like a hospital, but obviously I want to work in the doctor's office. just because I want to only work Monday through Friday, have weekends off and holidays, due to the fact that I think for my LP and RN program, I want to do the evening weekend program. So I mean, the process might be a little bit longer than the morning, but I feel like I'm in a position where I'll be making decent money. Me and my boyfriend, we're going to move into a house soon, sometime next year. And I just really, 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 really want that experience in outpatient. I don't work in outpatient as an aide to help the secretaries, but like as a nurse, no, I haven't. And I know that LPNs sometimes do the same work as MAs or something, but I actually have a friend who's at the main campus that I work at the Cleveland Clinic, and she's in the I can never say this word, endocrinology department, and she has an office with another LPN. She got a little coat, like a white coat. You know that the doctors wear the white coat? Yeah, she feel very important. She go everywhere her doctor go. Her doctor, she do presentations. So they treat her at that high standard, even though she's an LPN. You know, and she love it. Like, she love it. But she been an LPN since like 2013, I believe. Yes, like I really want to be in a doctor's office because my thing is if I don't go for nurse practitioner, I know I want to be in the surgical. Like I want to be a surgical nurse or I want to be CRNA. Like I have my mind. If I'm not a nurse practitioner, and I think I want to stay in the neuro because I really, really do like how the brain work. Like I really think I'm going to do good on this test. I hope, you know, them questions do be tricky because every question is NCLEX style. And every answer seems like, it'd be like two answers. You'd be like, okay, that's definitely not it. But the two answers that you be debating on, you'd be like, oh my God, that could be right, but this could be right. Them NCLEX questions going to kill me. But that's why I actually try to, like, study and do what I need to do. But I am definitely going to do a study with me. I think I'm gonna do Saturday St. Patrick's Day, so I'm gonna be celebrating that. I'm Black Irish, okay, but Sunday most likely, right? Lit, yeah. I definitely need it, but I know for sure I'm probably gonna do some study with me on Sunday for sure, and Monday, and we go on spring break in 2 weeks, and I probably just study ahead of time. Like, you have to stay ahead of the game in med-surg. Like, med-surg is a struggle. And people are like, oh, you passing. How's it a struggle? It's a struggle because it's hard to get this B up to an A. Because 1 week you could be on top. The next week you could drop down. I had an 88 and a 91 week. And I had a 72 and 80. My 87% went down to an 83.4. I had an 86.7. That went down to 83.4. 86.7, you round that to 87%. And it went down to 83.4. And you need an 83.5. That was a B. I was at a C. And then now I'm officially thank God we took that retake test. I'm officially at an 85.9. I'm actually literally 0.08% from an 86. That's why we rounded. So I'm trying to get up there in them A's. I'm trying to get all A's, you guys. But it's so hard with med-surg. Like, it's not even like the actual lecturing or the assignments. It's more like, I think the thing is, it's more that you actually, how can I say this? You just have to understand what you're reading. And I have a problem with, after a while, I'll be on it. Like, and you could tell in my test, because when I actually go and look at them over, from like, if it's a 50 question test, from like question 1, question 1 through 10, I probably got 1 answer wrong. Question 10 through 25, maybe 2. Questions 25 to 36 or something, I probably missed none to 1. Questions 45 to 50. No, I'm gonna lie. I'm gonna say that I lied. Questions like 42 to 50, I'd have missed like 6. I get so aggravated after taking a 50 question test, because after a while you just want to be like, okay, I want to go for the first answer I see. And I hate that I done that, because a lot of times when I looked over the test and I actually read the questions I got wrong, I'm like, oh, it's that. And I look like, what the hell was in this answer. I did that so many times. So I'm getting better at that. Really read them questions thoroughly and ask yourself first, like, what is it asking me? And once you do that, you got it. And I'm gonna tell you one time I messed up. It was a question about a person with heart problems. And the question was more like a nutrition question. And it was basically saying, a person with like arrhythmias or something or high blood pressure. I don't remember. But basically it was like caffeine would affect it. And I was like, okay, I know coffee, but if I don't see coffee, I know chocolates and caffeine. And the option was like, two of them was like fruit or vegetable. And I was like, it's definitely not that. Then I seen chocolate, and I was like, yeah, it's definitely chocolate. Then I seen tonic water. And I was like, damn, is tonic water like club soda? I think so. It's a difference between club soda, Candace, and damn tonic water. Tonic water is carbonated. It was definitely chocolate, and I second guessed myself. That was stupid. Yes, that was. I was like, I knew damn well tonic water ain't no damn caffeine in there. But when you taking the test and then she give you a time limit and you trying to keep looking at the clock and be like, dang, am I going too slow? Am I going too fast? Your mind just wonder. That's why if anybody got Apple phones, get an Apple Watch, and you just look at your watch every time. I always flick it real quick and then tell me the time, and I'm like, okay, I still got time. Because I'm blind and I can't see across the room sometimes. And I'm like, damn, I think I only got 5 minutes left. I swear I got 5 minutes left when I look at the clock on the wall. But that's pretty much it. That's my update. I promise I'm going to raise this B up to an A. And if anybody have any questions, just let me know. Like, do not hesitate. I keep telling y'all, let me know. Trust me. I'm here. Let me know. But that's pretty much it. I got to FaceTime my friend Char back. Bye, you guys. Good night. Ooh, I did knock the damn thing off. You're welcome. If you have any questions for real, just let me know, Simone, okay? Good night. Don't mind to hit me up. I give you my number if you need it. Bye.